afternoon. My name is Bhairavi Shankar and I'm here at the 2017 Canadian Science and Policy Conference. Joining me this afternoon is Dr. Deena Hamza, postdoctoral fellow in the Department of Family Medicine at the University of Alberta. Welcome, Dr. Hamza.
Thank you. It's wonderful to be here.
Thank you. So tell us about the work that you do and how did you reach this point?
So I'm currently a postdoctoral fellow in the Department of Family Medicine at the University of Alberta, and it's a joint position with the College of Family Physicians of Canada. And my role is to evaluate the medical residency program known as CCC, which was implemented in 2010. So to evaluate it on a pan-Canadian level to ensure that our family physicians, once they graduate from the program, are practicing in a socially accountable manner. And social accountability means many things, but what we're really looking at is that they're willing, confident, and competent to provide care in mental health, care to Indigenous peoples, care with marginalized, vulnerable, and disadvantaged groups. So this is across Canada, and it's really to ensure that our future family physicians are practicing in a way that's aligned with Canada's Health Act.
Okay.
So how did I get this in this position?
Yeah.
So I think along the way I've had really wonderful mentors. You know, from my family, my mother is an early childhood expert, and I grew up being around kids and seeing the differences in children and their behaviors. And my sister is a doctorate she has a doctorate in physiology, and also from the University of Alberta. So I've seen the research side as the mentor. I've had my sister as a mentor in that way. I've had my mom in this area of children. And so I developed this interest in children, youth, adolescents, and adults, but in the scope of mental health. But that's not where I started. For my bachelor's degree from the University of Alberta, it was in human ecology, specializing in textile science. And I was actually a fashion designer for about 6 years after graduating. So it came to the point when my mother asked me, you know, how are you helping society with your designs? And I thought, you know, at that time I was like, well, my designs make people feel better. So from her perspective, she thought, well, how can you help people on a much larger scale? Not everyone is going to purchase something that you've created. So how can you help people on a larger scale? And so that's where my interest went into mental health. I had wonderful supervisors, so I entered from a bachelor's into a doctorate program in psychiatry under the supervision of Dr. Peter Silverstone and Dr. Andy Greenshaw. Amazing individuals. Dr. Silverstone is an entrepreneur and really valued that I had that entrepreneur spirit and really honed in on that and really valued that. And Dr. Greenshaw just really appreciated my interest in prevention and early intervention. And so really that's really helped me along the way. My doctorate was in models of care for psychiatry, so mental health. We implemented an intervention in schools across an entire school district. I also participated in early prevention or early identification, prevention and early intervention in primary care clinics and in hospitals. After completing my doctorate research, I was hoping to stay within psychiatry and stay within that field, but I had an amazing opportunity with another supervisor, Dr. Shelley Ross, who is in the Department of Family Medicine. And she thought that my skills as a mixed methodologist would be really valuable to the department. And so that's how I became involved in medical education research. And at this point, she's one of the individuals who's very supportive of my interest in mental health. At this point, she's trying to encourage me, or she encourages me to participate in mental health type activities to bring that back to the Department of Family Medicine. So that position is shared with the CSPC, as I mentioned, College of Family Physicians of Canada, and my supervisor there is Dr. Ivy Ondasin. I'm also participating in some research with the School of Public Health, looking at policies. So that's how policy comes into play with mental health. Right. A big interest of mine, so it's not just here's this research, we know this intervention works, but now how do we apply this? And in order to apply it, we have to have a systems approach, and we also have to have a ground level approach. And my work is actually with Dr. Nikiforuk at the School of Public Health at the University of Alberta. So very diverse
range.
interdisciplinary pathway.
Yeah.
But I think that's the heart of this conference, is looking at interdisciplinary skills and how that can come to a unified goal.
And provide a diverse perspective.
Absolutely.
At it. So great segue into my next question, which is you had submitted a proposal towards the CSPC Science Policy Award
Yes.
for Excellence in the youth category, and we're recognized
Yes.
for your proposal by the space policy community attendees to this event and the Honorable Minister of Science.
Absolutely.
So,
and the
can you-
Chief Science Advisor,
the
Dr.
Chief-
Mona Niemer.
Indeed.
Yes.
And so would you mind telling us about what your proposal was and what got you into submitting it or applying for it?
So my proposal was actually bridging my doctoral research with my postdoctoral research. So it looked at mental health, immediately enactable strategies to enhance our mental health system, and some long-term goals. So the short-term solution that I presented in my proposal was just an extension of my doctoral research, where we would have opportunistic screening, where we would screen all individuals, whether it's in primary care through well and sick visits, or in schools as a regular procedure, or individuals themselves, through a computerized program. So we would have screening, a brief online intervention, one that is customized to the individual based on their screening scores. And then from there, if they require more support, they would have a referral to treatment. So it was that this computerized pathway to mental health care would be available to all Canadians in various settings. So that was the short-term goal. The long-term goal is to enhance the medical education curriculum, so that when an individual goes to a family physician, which is often the first point of contact, that the family physician would have some strategies to help that individual with their mental health, rather than sending them away or saying that they don't have a problem, or potentially feeling that they want to help but they don't have the knowledge, skills, or the competence or confidence to provide care, or sending them to care that's not appropriate, such as specialized care. Their symptomology doesn't fit with that.
Sure.
So we want to ensure that when somebody reaches out for mental health support, that everything is aligned to help them and not discourage them from seeking help. So that's the first part of the long-term goal. The second part of the long-term goal is to tie continuing medical education credits, which is something that every physician has to keep up to date with as a lifelong learner, to tie this to areas within our community that we have disparities. So for example, if we're finding that we don't have healthcare or mental health support in Indigenous communities, or we need to advance support in comprehensive care, that their continuing medical education credits would be stratified, and it would say how many hours, so how many hours have you put in for Indigenous health, or how many hours have you put in for marginalized, vulnerable, disadvantaged groups.
Wonderful.
Thank you.
Look forward to hearing more about what comes from that and hearing it more, I guess, more openly
Absolutely.
amongst the public.
Absolutely. I always tell people that this policy competition wasn't a win for me. This is really a win for mental health. So this is an
Indeed.
exciting opportunity and exciting for mental health.
Yes, and we look forward to hearing more about it.
Absolutely.
So you are a MyTax postdoctoral fellow.
Yes.
I find that is a very interesting combination of the industrial and the academic collaborations.
Yes.
Would you mind telling about how what process and experience you've had going through this particular type of fellowship, and what would you recommend to anyone who's thinking about something like this?
It's a very exciting fellowship. So I'll talk first about the experience, and then talk about my experience specifically with MyTax. So with the industry partner, who is the College of Family Physicians of Canada, I find that the work that I'm doing with them is very different than what I'm used to as an academic. The language, the approach with stakeholders, when we're meeting people on a pan-Canadian level and saying, let's advance our medical education curriculum, and balancing between the needs of change, so what we need to change, and balancing between the context. What can we actually change, and how fast can we change it? Because it's a very complex issue. It's not an issue that is simple, where I can take A and switch it to B. There's so many factors involved. So that experience alone has taught me how to deal with the public in a different way,
Sure.
outside of what are the statistics, what are the p-values, what's contribution and attribution or causation, and so on. So even the terminology is different when speaking with stakeholders, and producing a deliverable is different. So I'm not producing just academic manuscripts.
Sure.
I'm producing reports for the lay public, reports for stakeholders, technical reports for the actual organization detailing what we did in our evaluation. So very different. My experience with MyTax has been really awesome in that they follow up regularly via email to ensure that my experience is positive. And they routinely ask for feedback. And I think that's really valuable, that they're keeping in touch with the fellow to ensure that everything is going as planned.
Sure.
And that if there are any questions or concerns, that there is somebody that you can connect with. So it's been a very wonderful experience, and I feel fortunate to be a part of that.
Yeah, and it also means that you get to reach a broader audience that is not just within the academic realm, but rather more with the public and government and all of that.
Absolutely.
And
so it ties
valuable
into
experience.
that policy,
Yes.
which I'm very interested in. So,
Yes.
so it's a great opportunity.
Wonderful. So can I ask, what has been your experience attending this Canadian Science Policy Conference?
Mind-blowing.
In one word.
Yeah, in one word. Mind-blowing. I think this is a very unique conference. Not only in the interactions that you have with people from multiple disciplines, like different disciplines, but how we can come together and come up with some solutions together or ideas together. And I think having the government aspect, the policy aspect, the academic aspect, it seems intuitive that we would all be
Sure.
aligned, but the reality is this type of conference with the type of people that I've interacted with, I have not had the opportunity to interact with previous to this.
Right.
So this is almost a dream come true, in that you have this idea and you can share it with various individuals from various different areas that can provide guidance and provide support.
And I'm sure it provides new sources of inspiration
Absolutely.
to take your work further.
Absolutely. The number of connections that I have made is phenomenal, and everyone is so supportive and excited to be here and excited to hear new ideas.
Right.
So I think this is really a conference in which it can help someone flourish.
Wonderful. So for those who are unable to attend this conference, but will be thinking about next year or future years to attend, I'm sure they will use this as a
Absolutely.
definite
I would
point
recommend
of, yes,
recommend attending this conference.
All right. Well, thank you again for joining us, and I
Thank
wish you a wonderful rest of the time over here.
Thank you.